Wonnim red.
Oh, minim red, my nigga. Yeah, the building.
Wonnim red.
No, minim red. Yeah, the onim red. Abba.
Okay, ladies and gentlemen, as promised in yesterday's video, I told you people I was going to bring in a pharmaceutical doctor to come and explain to us what the red thing they mean, what it be, and why more boys they take and then they behave like zombies. Of course, it be an illegal drug where it did the system. But how they did get into the system? What be the, like, you know, the side effects? Why the boys take and they do like this? Now, yesterday in the video, I said, maybe I'm just commenting on what is trending. But when it comes to like the technical and the scientific and the chemical, physical aspect of it now, we have someone where you go school, go study, or cool school, so cool, so you born in papa. So, ladies and gentlemen, Dr. Greg is in the studio. Welcome.
Thank you.
But when him red.
Meaning red.
What's your red?
Mr. Red.
Red or tardy?
Now, so red.
Okay. Charlie, the boys know. I'm sure you've seen it.
Yeah.
What is happening in the news feed, and it be sad.
Twitter and so.
If really TikTok near you know, when him red, now boys now you say. First of all, what is red?
What is red?
Okay,
Is it just a color or something? I don't know.
So red on the street is also known as 225.
225. Other information.
Amorim, my nigga.
Amorim for adopt this formation.
So 225 is a strength of Tramadol.
Okay.
So Tramadol is an example of pain medication.
Okay.
So in pain medications, we have them that we call them opioids.
Okay.
So opioids, they are from the opium plant. And from that plant, we have the natural semi-synthetic, then the synthetic opioids. So under the natural opioids, that's where you have morphine, which is used for pain relieving effect. Then we have codeine that people have heard of in the cough syrups, like vanillin codeine. Yes,
red carb. Okay.
Yes, so that's codeine. Then we have the semi-synthetic ones. We have the oxycodone. Then we have heroin. Yes. Then when we come to the purely synthetic ones, we have Tramadol. So that one is lab made.
Lab made.
Yes, Tramadol. Synthetic ones.
Okay.
But those ones, the effects are always heightened. Even though Tramadol in its normal doses or usual doses are not stronger like...
What be the usual dose?
So the therapeutic doses of Tramadol, the formulations, you see 50 milligram.
50 milligram is okay.
That's for the immediate release. Then we have 100 milligram. So we have something called sustained release. So that one, the dosing is also different. It means that if you take one a day, it should be able to sustain you. That's why you call it sustained release.
Okay.
So that's the usual pharmaceutical doses or formulations that you see. If you're even giving to someone for moderate to severe pain, we have ways of dosing it. But the 225 in our country here is not licensed by FDA
to be sold on the counter.
To be sold. Okay. So any proper pharmacy, when you enter, you won't find 225 on the shelf.
But it is behind the counter?
No.
Okay.
So when it comes to opioids, because of their nature, which we'll get into when we get into the conversation, because they have what we know as addictive behavior. So we have the tolerance, then the dependence. It is classified under controlled medications. So these medications actually are supposed to be sold under prescription. And even with that one, it's controlled. So it's not everyone that you can dispense the medication to.
Chat, bro.
Bro, for my nigga.
Bro. I'm quite a cool school.
So, as I was saying, you can't dispense to everyone. And even with that one, you have to have a valid prescription. And even with that one, you can't dispense beyond certain number of days.
Okay.
So with opioids like the morphine, the oxycodone, so codeine, we don't play with them like that. Then we have fentanyl. We have different types. But today we are talking about Tramadol.
Yes, red.
So Tramadol, as I've told you, the reason why it's also addictive to people or it's dangerous is because apart from its pain relieving effect, it has certain effect that it has on the individual. So we have something known as euphoric effect.
Okay.
To be no manner as a feel irate.
Higher than the most high.
Higher than the most high.
Okay. Euphoria.
When
that series,
So that's one effect. Then when you are taking these medications, they cause the abundance of certain neuroreceptors. So they transmit nerve impulses. So one is serotonin, and the other one is norepinephrine. So these hormones, they control your mood, your anxiety effect. So as an individual, whether you're going to be anxious, so your mood, then the euphoric state, then even sometimes it causes some kind of relaxation. So you see some of the guys also who are feeling like they are drowsy. To be who will be say, why you see? So this is because the medication, when you consume it, even on the 50 milligram level, some people, if you are naive to it, you experience sedation. That's first one. So you'll be feeling like you want to sleep. Drowsiness. So assuming someone taking 3 tablets of 225.
Hold on.
Calculations, my mate.
No, because I don't know, I know, but I want to do the calculation. 3 times 225. That is 675.
So someone taking 675 milligram of Tramadol. So if 50 milligram is even making you drowsy, 600.
Imagine 625. Hey. 75. 675. Hey.
So that's what we are dealing with.
So that be what they make them and they do like that.
Exactly. And with that one, when you take it over a time, your body now builds what we know as tolerance. So tolerance means that, okay, if 50 milligram could give you a certain effect, you will now need like 200 milligram to give you that same effect.
That be the addictive thing.
So it means all the time you have to be increasing the quantity or the dose that you are taking. That's one. Then we have the psychological dependence. So because of the euphoric state that is giving you, the person will crave for more.
Yeah, a more fire.
Yeah. And the body is a special organ. And the brain functions in a very funny way. When these hormones that are serotonin and dopamine, and also even norepinephrine, when they are released, the body has ways to reduce their quantity. When that happens, your system now craves for that same agent. Otherwise, you begin to experience certain symptoms. We call it withdrawal symptoms.
Okay.
Also known as techie. I say techie achobi.
Oh, techie.
Yes, you I call it techie achino. So if you into drug addiction, won't say we take your achino. Second take your achobi, it means the person is craving for at the corner a man is stabilizing. So one is sweating, severe sweating, also with air conditioning refrigerating.
Okay.
So that's one of the signs of the withdrawal symptoms. The person's heart will begin to beat fast. The person will be in severe pain. The person will be restless. So if someone is undergoing all these symptoms, you can imagine the person will do anything
to go get
it.
Yeah.
So this is where theft begins. They can lie. Wait until share Juma from up to down.
Yes. Me mommy win yes me major trauma.
Or better share Juma no say. Oh, brown patch or come to me. When they give them the money,
then go take go by the drug.
That's it.
Oh no, I can't say no.
So that's red for you.
That's a red flag.
Very, very red.
Why the color red though?
So I think it's just the formulation.
Okay.
Because this even tablet. Tramadol comes in mostly capsules.
Yeah, green.
So in blue, it's mostly not for blue.
Okay.
Blue and white.
Blue and white. Yeah.
So it comes in that form. But this red is because it's not something that is conventional here. They put it that way, and red too is appealing to the eye. So those who know it, may pay red.
But some squad for the TL to the toxic people, they swallow them, they take the pie.
Yes.
How true is that?
So it also, because of the way it works, so when you take pain medications, your nerves are numbed into pain. It means no pain medication, I think say feel it. And during sexual intercourse, it's all about sensation. So if the person takes high doses of tramadol, it means the sensation on the penile region is reduced.
Okay.
It means the person can stay erected for a very long time without ejaculating. That's one thing, because continuous stimulation will cause the ejaculation.
Hey,
It say we need a chill here and I say,
Obe kuno. Obe one is abe. Obe one is a fufu. Because there is nothing. No. I said DB.
Exactly.
Dead wood be no the room.
Exactly. So the same thing, omo hard labor. Some people go into these drugs also.
Yeah. You swap blocks inside. Yeah.
To be honest, some people even add tramadol to energy drinks like Rush.
Hey,
Yes.
Adai. Again, I do we ask.
So on tramadol no kwana e man feel say oh daisy. Nti caffeine ne Rush ne
stimulating.
e be stimulating wabi.
Hey, Charlie, any kid in Naka too, the whole.
So you can just imagine.
Hey, but how did it end up on like the counter? How are people selling it?
So that's
because it's illegal, right?
Yeah.
It is not sanctioned by the FDA or Ghana Standard Authority. Yeah. But it's on the market. It's common. You see the boys posting the pictures. Actually, I did a video on it in the comment section. Some people saw it like as a normal thing for them to do. Like, Sheldon, shut up. This is something we have been doing.
Okay. So, you know that selling cocaine is illegal.
Yes.
But people are abusing cocaine or people are into cocaine.
Yes.
In the country.
Smuggle it.
Good. So, people smuggle it because the demand is there.
Okay.
And if you are there and someone is approaching with, let's say, 1,000 cedis for 10 tablets of, let's say, tramadol. And you know that maybe you can get that same 10 tablets from somewhere at 200 cedis. You know you're making 800 cedis cool money.
Yeah.
So that's where it starts from. There's a rising demand and the supply is there because there isn't too much regulation.
Okay.
Even though FDA is doing their bit, but I think they can do more.
More, okay.
The regulatory agents, they can do more. Because even some over-the-counter shops sell these things. Some drinking spots,
they do.
We say we've banned codeine, right? Banning codeine.
Yeah.
But you can find codeine on the market.
Even trophy. Since 19 something, but we still, you reach trophy.
Yeah. So we can all sit aloof and just look at it go on. But at the end of the day, we are destroying generations.
But Doc, so let's say continuously you take it. What be like the grand effect on your system? Because today there you go feel irate and things. In the long run, what be the thing? Like what will happen to you?
So we have something known as serotonin syndrome. So serotonin syndrome, it means there's hyper release of serotonin into your body. If that happens, your body will undergo severe forms of this side effect. So you can get hypertension. You can get severe joint pain, hyperthermia. Your temperature can just rise to very high levels. Agitation. You can even pass out. We have something known as respiratory depression. It means that you begin to feel difficulty in breathing. So people who do drugs, sometimes you say that, okoye drugs na afumeu. It's because the side effects of the medication, one is the respiratory depression. They can collapse
the whole system.
Now, there's one thing that it can also do. It can also put you at risk of seizure disorders. Because taking in tramadol, it reduces your seizure threshold. So it means if my seizure threshold is, let's say, here, it means I have to take something up to this level before I can get seizures. If I take tramadol, high doses, my seizure threshold drops to this level. It means any small thing can just put me into seizures. So assuming I don't know that I'm prone to that, I go in for tramadol. What do you think will happen to me?
Ooh.
Good.
Ayaka.
I'll be cast it.
Wow.
But that's not to say tramadol is bad.
Okay.
Because in my practice, when the campaign for Stop Tramadol came some time ago, when you are giving people medication that contains tramadol, they say, hey, tramadol, it is the dosing that's the problem.
Yeah.
We have regulated doses which are for clinical benefits or clinical purposes. Those ones are not harmful to you, the individual. So we have doses like 30 7.5. You can find them in combinations, para with tramadol. There's that combination that's on the market. Those ones are good. And even with that one, it's sold under prescription. So we should just know that. So that people will not say that, oh, anywhere I'll go, if they give me tramadol, you are not going to take it. Because we also have other pain medications or opioids, which are more dangerous than yes,
red.
Than even red.
Okay. But so the thing is, okay, so right now, before we came on air, you were saying that people feel they mix some with malt and milk and things. I feel say I eat all the two and why do you have to mix it with malt and milk and man? So that would be more treatment to your system.
That's one. Now, people want to experiment. I talked about tolerance.
Yes.
That you will be needing higher doses. So the effect the person needs, with time, the person is not getting that same effect.
Yeah.
So he has to do certain things to match up with that. So today, if I've taken tramadol, what will happen if I add blue to it? Blue.
Okay.
People mix diazepam with tramadol.
Charlie.
Some people will add codeine syrup in the cough syrup with tramadol. Then they'll put malt in that mixture, then put milk on it. Some people can even do that and put some juice on it. So if you go for a party and they tell a Charlie, you mix it in my punch, if you don't know what you're going to drink, Mr. It's not baby.
Charlie. I see some drug before the TL today. It's shaped like the penis. Have you seen it?
I've seen it.
It's red in color. What that one do they mean?
Oh, and also I think that one is a certain form of sildenafil.
Okay.
So that one is for sex enhancement. Yes, it's for erectile dysfunction.
Oh.
But the doses, that's the problem. People want it in so much doses, so they'll
take like 6.
Yes.
Anyway, so Doc, moving forward, what are we to do? What we for do? What it be about education? It be about the fact say the FDA and the Ghana, standard authority for do them work, or what are we supposed to do as a society to make sure that this thing no go become like a social canker where, because right now the videos I'm seeing be scary. Yesterday I saw a video where somebody just they give one food. I don't think he knows what is happening.
So I think the shocking thing is that most of these things you see it in the youth.
Yeah, young
from
guy.
the age of 15 to 20 something. Yeah, you see it around this age. So you can just imagine if you start with this, who will employ such a person? That's the first thing. So if you're into that, just imagine who will employ you. I'm not sure Sheldon will employ you to come and work for Sheldon.
We don't do that.
Now crack camera, nana, you see that.
On focus, bro. Charlie, crazy, man. Crazy.
That's the first thing. So education is very needed. If you're a parent, you have to check what your child does. I know people personally who got addicted to drugs and their parents weren't even aware. We, around the person, we knew, we prompted them. But the parents said that, oh, we don't like their word. By the time they realized, the child was in rehab. And such a person, talent is gone.
Okay.
That's one other thing that can happen to you. This thing too can cause an increase in social biases. Because if someone is undergoing withdrawal symptoms, you might be living your good life, responsible life. Someone will just pull a gun on you because he or she needs money to go and do these things.
Okay.
So we are not safe. So let's take care of ourselves very well. And also, these medications, when you abuse them in those combinations, remember all these medications you are taking, it is metabolized by either your liver or your kidney. So the more you abuse these medications, it means the more pressure you're putting on these organs. When this happens, it means that your risk of having kidney, liver conditions is going to balloon. And even now, people who are on dialysis are not finding it easy.
Yeah, it's true.
You can just imagine
Very
how it's happening.
expensive.
It's very, very expensive.
Yeah.
And kidney and liver transplant is also very, very expensive. So I would advise anyone to do that. It's not funny. There's a quote that we always say: 1 is too much, 2 is not enough. So don't even start. The first one you're going to take, it will be too much for you. You will feel that effect. But from then, taking 2 will not be enough for you to get that same effect.
Bars, my nigga.
Yes. So don't even start.
But then how you go feel, let's say you the one snap out of this thing. How you go feel do them?
It's not.
That's my farm, my drew my video and say, I did a doctor, but then how I go feel do them?
Now the issue is that willpower alone is not enough.
Okay.
So next time
okay.
It's not easy like that. You say it's easier said than done. Look at someone who is addicted to even betting. Dini sikasa.
Every studio,
Ubusane say, Charlie, I do
after every match, view jai.
Good. But the person goes back to it.
Next month, I should share odds.
Good. Willpower alone is not enough. It's like alcohol abuse.
Okay.
Because it goes beyond just willing to do. Now, there are rehab programs that a person will have to go through first. The person have to undergo what is known as therapeutic detoxification. Or say you detoxify our system. We have to clean. Good. That's one. Then we have to now separate the person from that. And it's a whole lengthy situation. And people even have the tendency of even going into relapse. Because my clean 4 months, the person just snap back into it and becomes worse. But that's the way we go. So psychiatric evaluations, the person needs rehab. If you are someone like that, you first have to know that you need help. You can't stop on your own. And in as much as we are religious people in this world, you can't pray someone out of addiction, especially drug addiction.
You can't pray someone out of addiction.
Yes. You can't pray someone out of it. Even though prayer is good,
it's good.
You have to combine it with all these modalities. And it's also expensive. I know people who have flown their wards from the north to Accra to Pantai Hospital because the child is addicted to drugs. And now they want the child to stop. So they have to bundle the child, put in an aeroplane. Look at all this stress.
Charlie, crazy.
It's bad. So if you are not into it, don't even start. If you are into it, kindly seek help, professional help. There are rehabs around which are very good. There are systems.
You have rehabs in this country?
Yeah, we have rehabs in this Ghana here.
Okay.
Yeah, but it's expensive. And you, the individual, you have to also be determined that you are going to journey through it. It's not going to be easy on you, but that's the information on the ground. So if you've not started, know that 1 is too much, 2 is never enough.
Yeah, I know say it be kind of like a youth thing, right? But when you see it be wrong.
It be. Now, this is the whole thing about these things. Especially with people who are addicted to these opioids. Obu or say when you accident.
Yeah.
The person had a fracture and was introduced to, let's say, Petidin or let's say Tramadol for the pain relief. Anytime the person takes it, the pain gets better. The person has been discharged. Instead of the person to be weaned off the medication, the person feels that, oh, this medication makes me feel okay. So anytime they are feeling the pain, they go in for it. So people with chronic pain end up abusing this also medication.
Okay.
Sincerely, they don't know.
Okay.
Some people, they never knew that, okay, this could happen. But because of a condition, they go addicted to it. I know colleague doctors who are addicted to certain pain medications. And most of them, it's not, though they know that this can do this to me, but when they began, they couldn't go off. And it has just destroyed their life.
Damn, bro.
Most of the health workers, if they are going to addiction, is so bad because they know which one and which one to
they
use.
have access to it too.
That's very bad.
Alright, so yeah, read the idea. I would say this one became popular through a song. So it's like our artists, most like some of them out there, they intentionally promote some of these things like codeine, lean, this man, and also we be catch from man.
So you know they are influential. So just let us know the content you're putting out there.
Yeah.
Because whatever you are doing, people are looking at you as a role model. You say it, someone out of curiosity, let me go and look at what this person is talking about. Then the person get hooked onto something. So those of us in the media space who have followings, please, let's be careful the things that we promote. You might do it for your benefit, but you might cause havoc to a lot of people.
Doc, last words to the boys and girls in the WhatsApp group who are going through these things. There are some people out there who actually think this is normal, and there are some people who they want to snap out of it, and there are some people who they want enter an experiment. And because right now we are throwing light on it, I don't think that more people knew about this thing, but right now I bought day in body. What be your general statement you go say about this red, crazy way did the system inside?
So to those who are yet to start, my advice to you that don't even go near.
Even bother, don't start.
To those who are in it, who say it is normal, don't think it's normal.
It's not.
There's no light at the end of that tunnel.
You do
There's no soul in it.
Good.
And to those who want to come out, know that there's help. Only if you are willing.
Okay.
Yes. And seek help.
When you take it, are you able to eat?
It depends on the type you are taking.
Okay. Because all the time I still say, like food they put in my hand, but they know if they eat. Or then they vomit or something.
Addiction is so bad. People sell their properties to get drugs. Millionaires go to pensioners out of addiction, drug addiction. So there's no light in that. It's bad.
Ladies and gentlemen, Red the audio but a lot of things for you to deal with. But yes, shouts to Doc for passing through for us to have this conversation. It was insightful and educative. So take whatever you want to take from it, but we are all trying to help, right? We are not going to use our platform to encourage people to go out there and abuse some of these things. Nah, bro, it's far from it. But when we discover something like that, we go talk about them, then bring in, somebody where the thing inside, an expert, maybe you can talk about it. And that is exactly what we are done with Dr. Greg. So you go feel link come up if you have any other question you want to ask with regards to what we just discussed. He creates videos about a lot of things, so you'll be fine. He will sort you out. And to Doc, your social media name Bibiana.
So to my people out there, connect with Dr. Greg.
Yes.
Has always been
on YouTube. He's on YouTube.
On YouTube.
Yeah.
X, Twitter.
Yeah.
Which is X. So Facebook.
Forget X and Twitter.
Facebook. Snapchat. Instagram.
Hey, Dr. Greg was Snap. Three girls in a row.
It's real.
But your turn,
So you can follow me there for more health content.
No, Miss Ramo on turn rule Snapchat too. But he has a pharmacy that he works with, right?
Yeah.
Good. Until that one day, it be Miss Ramo make nobody go DM and say, red, Wonnim red. No, go mind you say. But you go feel reach out to her if you don't want any information apart from this topic. If you have anything, I shouldn't encourage that. That'd be free consultation. They do that, bro. Go call the pharmacy and ask the hospital now. On you start. Ladies and gentlemen, my name is Sheldon. You name red. So you say the effect of red and you the red to be to me. And so when you're red now, they share me there and you are red. Yapon.